Dr. Jamie Massie from ORM Fertility. We know that when you start the process to partner with a gestational carrier to build your family, it can seem overwhelming. Not to worry, we're going to provide you with a roadmap to successfully navigate the journey. Research and planning. Partnering with a gestational carrier is an incredibly successful way to build your family. The most important first step is to partner with a fertility clinic and a gestational carrier agency with not only an excellent reputation, but years of experience. You're looking for teams that have effective communication, solid legal experience, and transparency in all aspects of their care for you. Once you've partnered with a gestational carrier agency and a fertility clinic, the next step is evaluation of the sperm and the egg providers. The egg provider will undergo some infectious disease testing, a questionnaire and physical exam that's required by the FDA. They'll also undergo an assessment of egg supply. The sperm provider will undergo similar testing required by the FDA, such as blood work and a physical exam. And their evaluation also includes a semen analysis to ensure that there's adequate numbers of motile sperm in order to fertilize the eggs that are collected. Both the sperm and the egg provider will be offered the option to undergo genetic testing. This is to assess for any increased risk of genetic disease in the embryos. Once this testing is completed, the next step is to create your embryos. The process of in vitro fertilization allows us to stimulate the woman's ovaries to recruit and grow multiple eggs at one time. The eggs are then collected in a simple and outpatient surgical procedure and fertilized with sperm in the laboratory. The resultant embryos then grow in the lab for 5 days, and at this stage, they're ready to either be frozen or biopsied for further genetic testing. So what further genetic testing is available for your embryos? We have the ability to biopsy embryos at the day 5 or 6 stage and test them with pre-implantation genetic testing for aneuploidy. This is a test in which we look to make sure that the embryos have the correct number of chromosomes. Abnormalities in chromosome number are the #1 reason that embryos don't implant or that implant and miscarry early. So by undergoing this testing, you could potentially improve the chance of successful transfer. Once your embryos are created, it's time to match with your gestational carrier. This is a collaborative process between you, your surrogacy agency, and ORM, with the ultimate goal being a match that optimizes your chance of success. By the time you match with a gestational carrier, your carrier will have already undergone extensive testing, which includes a medical evaluation, environmental, and psychological assessments. Once you've matched with your surrogate, you'll work with your surrogacy agency to finalize legal contracts and move on to the next step, embryo transfer. After hormonal therapy to prepare your surrogate's uterus for implantation, it's finally time for your embryo transfer. This is a simple procedure in which we use a catheter that's a little like a spaghetti noodle to place the embryo directly into the uterus under ultrasound guidance. A very long 9 days later, you'll have the result of your pregnancy test. Following your gestational carrier's graduation from ORM and transition to routine obstetrical care with her own OBGYN provider, your surrogacy agency will continue to follow and support you throughout the pregnancy and birth journey. Thank you so much for joining us today. We really look forward to the opportunity to support you and to be part of your journey.